This event is jointly organized by the ZTG GmbH, the Center for Telematics and Telemedicine, the German Society for Telemedicine, and the Ministry for Labor, Health and Social Affairs of North Rhine-Westphalia. We have, if you are interested, we have here a special day program that would also be available over there, but I place it, we will find a way that it comes to you. The program is written completely in English, but we will switch languages a bit over the day. So let me just continue with my very little introduction in English, and then we will switch over to German to welcome Dr. Watzlawick. So the idea of this event, as it has been in the last years, is to, let's say, to reflect the central position of North Rhine-Westphalia in Europe, close to very active neighbors also active in e-health and telemedicine. And once more over the day, we have invited for you representatives of the ES network, of the European Commission, of the German Health Ministry, from the Netherlands, from Finland. We have a special session on mobile health at lunchtime, where we will welcome a speaker from the Commission and others. We have, in a way, we have a special Portugal feature today, because we will have two speakers from Portugal, one speaking on behalf of the ES network, another one speaking for telehealth and mobile health. And we have a roundtable on telemedicine in the afternoon, where we are reflecting most recent developments in Germany with opening up for more teleconsultations. And how can you do an event without speaking on artificial intelligence? That's what we'll do in the afternoon. So, ich darf jetzt in Deutsch weitermachen. Es ist meine Ehre und Freude, Herrn Dr. Helmut Watzlawick zu begrüßen. Er ist Abteilungsleiter hier im Ministerium für Arbeit, Gesundheit und Soziales in Düsseldorf, einem der wichtigen Hosts der ganzen Medica und speziell jetzt dieser Veranstaltung. Und Sie werden uns jetzt die Position von Nordrhein-Westfalen oder die auf dieser europäischen Landkarte näher erläutern. Danke, Herr Dr. Watzlawick. Und ich möchte noch ansagen, dass ein Welcome by the Organizers wird dann nach Herrn Dr. Watzlawick wird Herr Professor Marx von der RWTH, gleichzeitig RWTH Aachen und auch Präsident der Deutschen Gesellschaft für Telemedizin, wird danach Herr Dr. Watzlawick ja auch noch eine kurze Begrüßung sprechen. So, jetzt bin ich aber fertig.
Ich hoffe, es ist laut genug und Sie können mich verstehen. Erstmal, sehr geehrter Herr Professor Dr. Marx, sehr geehrter Herr Dr. Schuck, herzlichen Dank für die Einladung. Ich darf Sie auch im Namen der Landesregierung Nordrhein-Westfalen sehr herzlich hier auf der Medica begrüßen. Ich glaube, man sieht das hier auf der Messe sehr, sehr eindrücklich, dass die fortschreitende Digitalisierung ganz große Potenziale für die Versorgung auch erschließt. Und ich glaube, das ist auch so das Wesentliche. Digitalisierung darf kein Selbstzweck sein, sondern wir müssen immer, gerade auch als Landesregierung, schauen, wie können wir dadurch die Versorgung der Menschen verbessern. Das muss das oberste Ziel sein. Und ich glaube, dass wir mit der Digitalisierung auf einem guten Weg sind, das sieht man nirgendwo deutlicher als hier auf der Medica. Der heutige Thementag trägt auch der großen Bedeutung der europäischen Entwicklung für Digital Health Rechnung. Und ich möchte mich ganz am Anfang für die Ausrichtung bei den beiden Veranstaltern sehr herzlich bedanken, beim Zentrum für Telematik und Telemedizin und der Deutschen Gesellschaft für Telemedizin. Europa geht den Weg zu Digital Health. Und ich glaube, dass das Programm, die Auswahl der heutigen Redner dem auch sehr gut Rechnung trägt. Und ich möchte beginnen, aus guten Gründen, mit den Vertretern des portugiesischen Gesundheitsministeriums, Portugal hat Verantwortung für den weiteren Aufbau von E-Health-Diensten in Europa insgesamt übernommen. Ich möchte hier begrüßen Herrn Diego Gomes in Vertretung von Herrn Henrique Martens. Herr Martens ist neuer Co-Vorsitzender des Artikel 14 E-Health-Netzwerks. Dieses Netzwerk arbeitet auf Grundlage der Patientenmobilitätsrichtlinie von 2011 und entscheidet zu Fragen grenzüberschreitender E-Health-Dienste. Herr Diego Gomes wird heute in Vertretung sprechen. Ich darf auch sehr herzlich begrüßen Frau Dr. Micaela Monteiro, die digitale Gesundheitsanwendung in Portugal vorstellen wird. Und vor dem Hintergrund der Planung für die elektronische Patientenakten gemäß unserem SGB V in Deutschland beobachten wir natürlich sehr aufmerksam, was in Portugal passiert und sind sehr gespannt auf die Präsentation. Begrüßen möchte ich auch Frau Ineke Hasselset, Patient Expert von der Stiftung Econe. Sie stellt das Modell der Niederlande für den Zugriff von Patienten auf eigene Gesundheitsdaten vor. Für Finnland begrüße ich Herrn Hannu Hämmerleinen. Ich hoffe, ich habe das richtig ausgesprochen. Ich kann kein Finnisch. Finnland baut eine große nationale Datenbank mit digitalen Patientendaten auf. Und hier ist das Thema Big Data ein großes Thema. Zudem wird Finnland in der zweiten Jahreshälfte 2019 die EU-Ratspräsidentschaft übernehmen und wird sich sehr stark für die europäische Agenda für digitale Gesundheit einsetzen. Last but not least darf ich noch den Kollegen aus dem Bundesgesundheitsministerium begrüßen, Herrn Niklas Kramer aus der, glaube ich, noch neuen Abteilung Digitalisierung im BMG. Er kommt auch unmittelbar von der Sitzung des E-Health-Netzwerks in Brüssel und wir sehen auch Ihrem Bericht mit großem Interesse entgegen. Ja, meine Damen und Herren, die Juncker-Kommission hat den Bereich der digitalen Transformation sehr konsequent gefördert und weiterentwickelt. Dabei erhält die Digitalisierung im Gesundheitswesen weiter zunehmende Bedeutung und nimmt etwa in der Halbzeitbilanz zur digitalen Agenda im vergangenen Jahr eine zentrale Position unter der Überschrift E-Government ein. Und das kommende EU-Parlament wird mit dem EU-Haushalt 2017 bis 2021 über die Bereitstellung von sehr erheblichen Mitteln zu diesem Zweck zu beschließen haben. Gemäß einer Mitteilung der Europäischen Kommission werden folgende Themen Priorität haben, und zwar einmal der sichere Zugang der Bürger zu Gesundheitsdaten und der sichere grenzüberschreitende Austausch dieser Daten. Dann bessere Daten für die Förderung der Forschung, von Prävention, für personalisierte Medizin und Versorgung und Pflege. Und das Thema digitale Hilfsmittel und eine aufgeklärte Mitwirkung der Bürger und eine patientenorientierte Pflege. Ein sehr wichtiges Anliegen der Kommission ist es, den Bürgern überall in der EU Zugang zu ihren digitalen Gesundheitsdaten zu geben. Sie sollen weitgehende Kontrolle über ihre Gesundheitsdaten ausüben und diese selbst an zugelassene Partner weitergeben können. Die Kommission hat im Frühjahr die Entwicklung eines europäischen Austauschformates für Patientenakten angekündigt. Die Arbeiten werden also konkret. Zum Thema Nordrhein-Westfalen. Wir erheben für uns den Anspruch, Vorreiter bundesweit zu sein bei der Einführung von Telematikanwendungen und von der Telemedizin. Und das wissen Sie auch alle selber, die Telematikinfrastruktur ist ein Thema, was uns schon sehr lange beschäftigt und auch für viele Politiker auch einen sehr quälenden Prozess darstellt. Aber es ist halt einfach eins der größten IT-Projekte in Europa und deswegen dauert sowas auch ein bisschen. Und die Digitalisierung, sie trifft ja nicht nur das Gesundheitswesen, sondern alle Bereiche der Wirtschaft, der Arbeitswelt, der Verwaltung, der Umwelt. Und deshalb hat die Landesregierung insgesamt hier in Nordrhein-Westfalen das Thema Digitalisierung ganz oben auf ihre Agenda gesetzt. Und wir arbeiten derzeit bis zum Jahresende eine Digitalstrategie, die alle diese Bereiche abdecken wird. Ein Schwerpunkt unserer Digitalstrategie im Gesundheitswesen ist unser Ziel, dass wir bis 2020 alle 120.000 Arzt- und Zahnarztpraxen, über 350 Krankenhäuser in Nordrhein-Westfalen und über 4.000 Apotheken vernetzen möchten. Diese Vernetzung, verbunden mit Anwendungen wie dem elektronischen Arztbrief oder der elektronischen Patientenakte, wird vor allem die Prozesse in den Praxen und Krankenhäusern mit Sicherheit sehr wesentlich verändern. Wir werden darüber hinaus die Digitalisierung in unserem Bundesland auch in der Telemedizin weiter vorantreiben und konkret unterstützen wir Beispiel die Verbreitung von Teleintensivmedizin, die im Rahmen eines der größten Projekte des Innovationsfonds am Uniklinikum in Aachen durchgeführt wird. Wir unterstützen die Verfügbarkeit von Videokonferenzen an rund 40 Krankenhäusern im Münsterland und wir unterstützen die elektronische Pflegevisite im KV-Bezirk Westfalen-Lippe als einige Beispiele. In Nordrhein-Westfalen werden wir bundesweit die ersten medizinischen Anwendungen der elektronischen Gesundheitskarte auch testen, und zwar das Notfalldatenmanagement, den elektronischen Medikationsplan und den elektronischen Arztbrief. Und in NRW, das unterstreicht auch nochmal die Vorreiterrolle, hat im Auftrag der Gesundheitsministerkonferenz das Forum Elektronische Patientenakte eingerichtet. Hier sind alle namhaften Aktenprojekte in Deutschland sowie die Vertreter von Selbstverwaltung, Industrie und Wissenschaft vertreten. Und aus unserer Sicht ist die elektronische Patientenakte mit Sicherheit die am Abstand wichtigste medizinische Anwendung. In Nordrhein-Westfalen halten wir es darüber hinaus auch für unbedingt notwendig, auch die arztgeführte Kommunikation zu fördern. Und deswegen setzen wir uns mit der Krankenhausgesellschaft auch für die elektronische Fallakte ein. Ich lade Sie nachher ein, hier in Halle 15 auch den Landesgemeinschaftsstand NRW zu besuchen. Er ist, glaube ich, da weiter hinten. Wir führen Sie gerne hin und überzeugen sich, dass wir hier in Nordrhein-Westfalen gute Projekte fördern und Motor sein wollen in der Entwicklung, in der Förderung der Digitalisierung im Gesundheitswesen. Vielen Dank und einen erfolgreichen Tag heute.
Ja, vielen Dank, Herr Dr. Watzlawick. Bleiben Sie noch ein bisschen bei uns. Oh ja. Sprechen Sie Deutsch oder Englisch?
English.
Okay, then it's my pleasure now to switch to English and to hand over to Professor Gernot Marx, medical doctor, and he's, as mentioned, president of the German Association for Telemedicine, and moreover, he's dean and head of department surgical intensive and intermediate care of the RWTH Aachen University Clinic, Professor Marx.
Yeah, dear Dr. Schuck, thank you very much indeed for the organization of this very interesting meeting. I would like to welcome you in my function as the chairman of the German Society of Telemedicine, and especially I want to welcome Dr. Watzlawick, Mr. Kramer, and all the esteemed speakers from all over Europe. We know that we can learn a lot in this area from other countries like Finland, Portugal, Iceland, and so on. We have felt, especially in the last couple of months, that a lot is happening in Germany, all over Europe, worldwide. We feel that the dynamic is increasing, but also that the citizens, the EU citizens, are expecting from us that a lot will be now established and that they want to have their service. They know from their iPhones or Androids that they want these kinds of service also in the digital health landscape in Europe. And this is our job, what we have to do, to deliver. And as a medical doctor, I'm convinced, and I do know, that the potential of digitization is huge. I've just recently read from an American source a statement that in 2020, every 73 days, the medical knowledge is doubling. And it is very clear that even if it's a little bit less, but it is very clear that we cannot fulfill our job as medical doctors, as healthcare workers, to deliver the best quality of care to our patients and citizens without support, without digital support. And this is very, very important, because that is what we want to do. We want to deliver the best medicine possible. And I'm convinced that medicine will be a lot better when we're using digitization, when we're using artificial intelligence, One of my colleagues in Aachen just showed me a couple of days ago data. He used the MIMIC database from the States, and he was able now to develop algorithms which can bring the diagnosis of septic shock 12 hours beforehand. And if this is really then in the ongoing tests will be then true, this would be an enormous development for the development of care, and this will really save lives. And this is our goal, that we really deliver better medicine. It's not about technology and shiny and being innovative and cool. It's about delivering better care and to bring the best possible medicine and possibly really personalized medicine to our citizens and patients. And this is the reason we are here, and we discuss and we inform each other, and we have to deliver it. The time is running, and I think we have in the next 5-10 years we really have to speed up to reach really our goals in this time frame, because within the next 10 years otherwise other will do it. You know what I'm talking about. And I'm very proud that you're all here, that you're listening, and the one of the basic needs is really that we know what everybody of us is doing, and that we change between our knowledges and experiences. And this is one very important issue in terms of save time. And with this, I want to close. Thanks again for coming. I'm looking forward to a fruitful discussion and learn from each other. Thank you very much indeed.
Thank you, Professor Marx, for this thoughtful starting statement for today. So we close now, let's say, the welcome part and start with our first session, which is titled Mapping the Landscape, the Impact of Health for the Digital Single Market. And maybe just one word of explanation. What can be observed now over the last, let's say, 5 years, whatever time scale we grab, we had the digital agenda for Europe, which is now already a bit outdated, has now, let's say, been transformed in the continuous messaging around the digital single market. And what could be observed now over the last years was that that healthcare, digital healthcare, has become one of the most important themes in the whole area. So it's no longer the case that healthcare was, let's say, a little bit set aside, as were the complaints that healthcare may move too slowly in the age of digitization. It's now clearly, and the head of section already mentioned it, the half-time checkpoint of the digital single market 2 years ago clearly put a spotlight on digital health, and this will continue, as we will hear over the day. So that's why we have here the impact of health for the digital single market. It's one of the main, has become one of the main streams. So it's now my pleasure to welcome Diogo Gomes from the shared services of the Ministry of Health of Portugal. But he speaks today, let's say, with a double hat. The boss of Diogo is since June this year, Henrique Martins, you will help me to pronounce it. He is a member states co-chair of the ES network, which is this meeting place where the member states come together to agree on the way forward for cross-border services and interoperability in digital health. So Diogo will today stand for, of course, his home office, the SPMS, but also for the network and the ES Action project, which is a new support project. So I guess Your slides are on, so Diogo, thank you for coming.
Okay. Thank you very much. Good morning, everyone. I want to thank, in behalf of Enrique Martins, the invite to be at Medica, this important forum from our community, and I will speak you about e-health and the means of e-health to the joint action and what is joint action. I will read, because this is technical and a little bit bureaucrat content, and to reach you in a way more efficiently. So, let's do just here an introduction. The right e-health means access to better health coverage. That means transparency, sustainability, quality of care, quicker and better treatment, improvement of medical services. So it allows us the opportunities to more accessible treatment, more efficiency, disease prevention and control, and better healthcare. The joint action, the e-action, or the third joint action in e-health are aligned with the digital single market pillars. The secure data access and sharing, the connecting and sharing health data for research, faster diagnosis, and improved health, strengthening citizen empowerment and individual care through digital services. That means the access, all the environment around the e-health ecosystem and the economy and society. The e-health network. The e-health network is a volunteer network created under the Article 14 of the Directive 2011-24 from the European Union, established in order to ensure the progress on e-health and to bridge the gaps between the governance strategy and operational levels. Responsible on the strategic level for all the e-health policies in Europe, it provides a platform for member states, competent authorities responsible for e-health, and is scientifically and technically supported by a joint action. So, what is a joint action? A joint action is a collaborative action between the member states and countries which is committed to develop and improve the third e-health program. Together, in this collaborative joint action, it is more efficient to share, refine and test methods, tools and use cases, and to generate new approach within the e-health scope. This joint action works towards delivering sustainable economic and social benefits for Europe e-health system and services. Based on interoperable applications, the aim is to achieve high levels of trust and security, enhancing continuity of care and ensuring access to a safe and high-quality healthcare. So, the mission and ambition of a joint action in an e-health joint action. We want to integrate e-health into their health policy at national levels, align e-health investment with overall health systems requirements, achieve health systems sustainability, achieve transferability of health data across borders, and lost the legal, operational, semantic and technical domains. Here are the headaches of our member states. Meet information privacy and data protection requirements, improve interoperability and cybersecurity across countries to be addressed by the next joint action we are outlined. Without trust, there is no sharing of data. Share and access data across borders and facilitate the access to e-health data personalized care. So, the e-health network is the coordinating and governing body, while the purpose of the third joint action that we call e-action, that was the first joint action, the second joint action called JSON, and this third joint action we call it e-action. We call it e-action because it's time to go action. We, at this level, at these projects, we produce a lot of content, a lot of documents, a lot of technical and bureaucrat documents, but we have to go live and implementing our aim and our vision for e-health. So we call e-action. It's time to go action. We try to do action, but we start at 6 months so far, and we are committed to accomplish the multi-annual work program 2008-2021. And e-action, it aims to develop a strategic recommendations and instruments that could feed in the political discussions and facilitate cooperation in the 4 priority areas that are specified in the eHealth Network Multi-Annual Work Plan 2008-2021. So, these are the 4 main priorities from the Multi-Annual Work Plan 2018 and 2021. Innovating use of health data, enhancing continuity of care, overcoming implementation challenges, and empowering people. Our e-action is supporting the health network in the accomplish and the implementation of the multi-annual work program. Sets target exploring the e-health to facilitate the management of chronic disease and multimorbidity by increasing sustainability and efficiency of health systems and by facilitating personalized care and empowering the citizens. The e-action is in line with the 3rd program of EU actions in the field of e-health contributing to foster health in Europe by promoting the use of e-health in a structured policy framework. So, the multi-annual work plan defines 4 priorities, and then now we in e-action has had one more, the e-health national policies and sustainability, because we know that the 4 main priorities defined on the multi-annual work plan were the baseline, but we know without national level, without the national vision, without the national connection about the policies, we don't achieve our aim. These are the framework or the division of the 8 work package. We see here Germany is leading the work package 6, the enhancing continuity of care. Portugal are leading the coordination and the dissemination. The previous coordination of the previous joint action, it was leading by Austria. In this moment, they have leading the work package 3, the evaluation. Now I will invite everyone to see this video resume from the e-action. Just take a minute. This is our aim to relationship all the work package. All work package have his content, his ideas, his documents, and the work package 2 have to do some creative things to disseminate this technical content. Here is our aim to the life cycle of the stakeholders' engagement in the project. What I was saying, we have to say it with an image. We know that the Instagram are rising up and the Facebook is rising down. So, how to communicate the difficult content? You know, I was speaking here in English, but it seems, I think I read purposely and despacio, slowly to everybody understand. It's not quietly to understand this framework, this governance, and this appliance, and how we can reach not over the stakeholders, but the citizens and the professionals. So, we are communicate our work in these infographics, this complex message with the infographics. Here we can see the mHealth, why is important, to see an image, and we can see all the benefits from mHealth. If I read again a text, everybody was staring to the side or, whoa, boring. So, we are trying to engage every target group, to understand our message and to understand our aim. Of course, we have a website. If you can visit, they have all the information available. And we have the social networks. Right now we have the Twitter and the Facebook. You can see the KPIs from the followers. I will ask everyone to know more about the action to follow us. And I will leave you with this video because in the end of the day, we want this for Europe. Thank you so much for your attention, and I want to invite everyone to go to Portugal, to Lisbon, in the 19th to 20th of March to our e-health summit. You are all invited. Thank you so much. Thank you, Dr. Schug.
So please stay with us, Diogo, here. Good. Thank you very much. Very warm. So, as we can see, the passing over the coordination of this European task to Portugal brings a lot of additional color and inspiration to the subject of cross-border healthcare and of European collaboration. And I think this nicely also matches what has been said before. It's now coming out of the ivory tower. It's coming everywhere. So people, citizens, patients have to understand the message. And thank you for doing such a good job in preparing this so that everyone can really understand what it's about. Before I continue with the next speaker, is there any, I would allow one question from the audience or one comment if there's anything which is immediately upcoming. Okay, you do not have to think of a question, then we continue with the next speaker and then you come after the next presentation. So now it's my pleasure to invite Niklas Kramer here on the stage. Niklas is a policy officer in the new Department of Digitalization and Innovation in our German National Federal Health Ministry. And he is also supporting the representation of Germany in the ES network, so he can now bridge a bit Europe and Germany for us. Niklas.
Yeah, hello, Mr. Schug, thank you for the introduction. And thank you also for the invitation here to the Medica. My name is Niklas Kramer. I work
for the Federal Ministry of Health. So, and I'm here for our director, Mr. Ludewig, who unfortunately could not be here. So he asked me to be here with you in Düsseldorf. For those, for our international and European guests, North Rhine-Westphalia is, I think you can say so, a very one of the most active Länder in Germany if it comes to e-health, and this forum, I think, proves this very well. And you also are very keen to always bring up this European topic and to give a forum here to discuss this European topic. I am now here to present you a bit where we stand in Germany if it comes to digital health from a federal perspective. What are our policy aims here in Germany? Where do we stand? And then also, which was also touched upon from a project point of view by Diogo, why are we working together on the European level, and what added value do we see in the digital single market, and what can come out of this? So yeah, if we talk about digital health from a policy perspective, I mean, I think I don't have to repeat the policy aims we have. In the end, it is, of course, about how Professor Marx said, about improving the quality of care, better information in the healthcare system, to improve patient security, and trying to make the system more efficient using digital tools. I think this is clear. A very precondition for us is, of course, then to have a secure infrastructure so that health data is secured and can be shared across the system. In Germany, this is the so-called telematics infrastructure, and with the electronic health card. Here, at least for our German guest, I think you know, we have seen, let's say, over the years, certain delays, but the political level and the Federal Ministry of Health and the federal government already in the last legislative period, but also now, said, okay, we really have to speed up. So what the policy level did was to put forward the eHealth Act in 2015 in order to really take up speed, accelerate the whole process, because the understanding was that we cannot wait any longer. If we want this project to be a success, we really have to take up speed so that in the end the medical applications can start, so that the citizens really see the added value of what we are doing here. So this eHealth Act put forward a concrete timeline, incentives, but also sanctions for the actors in order to accelerate the building up of this infrastructure. And we have seen the rollout now in 2017, and it's continuing, and we are expecting to have the whole infrastructure in place next year. This is one of the biggest IT projects in the world, you can say, and it will in the end connect the entire German health system. So it's quite something. And then by next year we will also see the first medical applications on this infrastructure. Now, with the new government and also our new minister Jens Spahn, the digitalization was put even more as a priority of the federal government and of the Federal Ministry of Health. This was also being shown by what has said before, that we have a new directorate only on digitalization and innovation in the Federal Ministry of Health. And the goal now for this legislative period, which was also set by the coalition treatment, was that we want to have electronic health records by end of this legislative term. So the electronic health records as sort of the crown applications you want to have, and our minister puts a lot of efforts on this, and also our directorate, in order to come up with this goal. And first legislative adaptations already have been done. So we have put forward an obligation to the insurance funds. In Germany we have insurance funds, we have several insurance funds, to come up with electronic health records by end of 2021, and that it's important to have a interoperable federal-wide electronic health record, so you can share your data. If you change your insurance funds, you can bring your data with you. And here we have seen also some new engagement, and we the first specifications will be also put forward by end of this year. Other than that, we are working on also further legal adaptations. We are expecting to have a new law on digitalization in the healthcare system. So if it comes to the core infrastructure, we are trying to take up speed. We know we are lacking behind if it comes to the comparison with other nations and member states in Europe. But the political will is there, and as Stefan, I think, said, this is now really coming out of the planning phase and out of the discussion, but we are really entering a phase of seeing real applications for the citizens. This is the first thing. The second, telemedicine. Here we also see sort of new dynamics in Germany. We already have a very rich telemedicine landscape, let's say, but now also we see that in May the German Medical Association set further options for remote treatment. We have done on the policy level, we have set certain let's say incentives and financing structures for innovation. One of these is the Innovation Fund, which is aiming at integrative care, but uses a lot of IT structures and telemedicine elements. So in general, we see also on the health insurance funds, we see let's say rising willingness to invest really in new tools, and then we, from a federal level, we want to set further incentives. We want not to block these developments, but we want to support these developments so that telemedicine can take up. The third element, and then I will come to the European level, is of course the whole question of big data research. How can we make use of all this data we have in the healthcare system, which is set in the different silos, and where we see huge potentials for personalized medicine, and how to set the framework on a legal level or on a federal level, so that we at the same time are sure that this is being done under ethical values and there is a ethical legal framework to that. Here our colleagues from the Federal Ministry of Research and Education, they are financing a very promising program which is called the National Medical Informatics Initiative, which is building up data integrative centers between university hospitals and I think will come up with proven benefits for interoperability and data sharing. And we, from the health system or from the Ministry for Health, we want to build up on this and we want to enhance our strategy here. We are also financing piloting projects in the area of big data and artificial intelligence to then also come up to prove the benefit and based on this also to develop the framework further. If it comes to AI, the federal government as a whole will present its AI strategy in the beginning of this December. And there we will also see new public investments for AI on the different levels of this strategy, starting from educational level, but also then research level, and then also trying to address the questions how to support AI to come into real life. So this was sort of the points we are following here on the policy level in Germany. I think I have not so much time anymore, but I just want to shortly show you, okay, what are actually now the added value of European cooperation on these topics and the digital single market, because you could say, of course, these are first of all national homeworks. We have different health systems in Europe, and we as the national governments, we have to simply do our homeworks, which we do, but at the same time there is added value because I mean, if we look also at the other areas in the world, we are of course also in on a competitive level, let's say, and here Europe can bring the benefit of that we use our expertise we have in Europe. We interconnect the expertise we have in order also to scale up research, to support our researchers. And here we see several instruments on the European level. One of these is the research financing, the Horizon 2020. Professor Marx, he's now not here, but he himself also took part in European projects where they use these European funds in order to have a sort of a European pre-procurement, because they were looking for a software in tele-intensive care, and this was not on the market, but they used this and they were really trying to connect the expertise on these topics we have in Europe. And in the end, they came up with a very promising software also in the area of tele-intensive care. Then it is about best practice exchange on the policy level. Also, we want to exchange on common challenges we have. And then third, it's about interoperability and also trying to discuss standards and IT standards on the European level. I have brought some examples, also the European reference networks on rare diseases, but I think we are a bit running out of time. Just about the third point, Stefan said so, we have a so-called European e-health network, which is the most, let's say, legitimate legal body we have on the European level where policymakers come together in order to set guidelines for interoperability. So here we are aiming to support concrete use cases which can make an added value. For instance, a patient summary. If you want to go cross-border, you can take your data with you. Here I think we can come up with concrete add-on services, let's say, to our national services, even though we know patient mobility is not in comparison to, let's say, the national healthcare is not that high, but nevertheless we can come up with good added services. And secondly, and this is also important, indirectly we discuss standards, and we want to align our standards, and we want to have a discussion on these topics in order to also let's say support the market development. Of course, I mean, Germany is a bigger country, but even in Germany, I think it's necessary not to develop only own standards, but we have to see how to make use of this European exchange. So I want to stop here. If you have any questions, I'm happy to answer these questions, and I hope I gave you a good overview. Thank you.
Thank you very much, Niklas Kramer. Any immediate question from the audience? Okay, we will have a questions and answer round later on. Thank you for joining us here. So it's my pleasure now to welcome a speaker from the Netherlands, Ineke Hezelstedt. She is a patient expert from Icone Foundation, and she has actually been nominated as a speaker by the Ministry of Health, Welfare of Sports in the Netherlands to join us here today. And I'm underlining this a bit because there is also some bilateral collaboration between North Rhine-Westphalia and the Netherlands ongoing, and also planning. Since, as you may be aware, of course, there are large border regions, and while overall European citizens may not go so frequently over borders, we have now some regions in Europe, and the region of Twente and Münsterland and Aachen-Maastricht definitely belong to those where some patients live permanently, let's say, in the other country, or are working permanently there and are crossing the border every day also in healthcare. So with the Netherlands, we have a kind of a joint view on many things. So Ineke will now speak to personal health environment, patients managing their health and health data. Ineke, thank you for joining us.
Vielen Dank. Ich werde auf Englisch sprechen, obwohl Deutsch und Niederländisch meine zwei eigene Sprachen sind. Good afternoon, ladies and gentlemen. Since 2010, my medical core team and I are involved in a health and care innovation process, patients managing their health and health data. My name is Ineke Hezelstedt. I represent the Dutch Ministry of Health, Welfare and Sport and the Icone Foundation. Icone is based in Zwolle. Icone's mission is to improve quality of care by enhancing the cooperation between patients and healthcare. Since January 2017, I am one of the patient experts. Over our 50 patient experts bring in the patient's perspective into our services. We train, advise and help our clients to work more patient-included, value-based and human-centric. You could become Icone's next client. I hope so. I welcome you. Living with chronic health conditions means having a part-time job. I use analog and digital health technology to manage my health and my health data. I was trained how to use this health and information technology correctly. Continuity in my personalized healthcare process, participation in society, living my life in the way I like, free of exclusion, stigmas, or prejudices are important to me. My team and I need digital access to information. This means complete and correct, structured and one-off captured health data with context. It is about better quality of care for better quality of life. I am born with mild lung problems and slight pain in my right hand and arm. The general practitioners and the pediatricians involved in healthcare delivery during my childhood made a lot of notes, and I underwent a few examinations. Years went by until the late spring of 2018, when I was diagnosed with a very common lung disease, chronic. A bony formation with some other tissue at my right upper arm has been recognized this summer as the cause of the pain and meanwhile reduced strength in my right arm and hand. Most of my health data from birth in the late 60s till 1987 has been lost. July 1987, I entered as an adult the Dutch healthcare system after a sporting accident a few months earlier. Years went by while my health condition deteriorated. 2007, I was diagnosed with a chronic neurological syndrome. My medical team and I needed all relevant health data over those 20 years. Years ago, I made an interesting phone call just after the Dutch Healthcare Inspectorate published a report about 6 very severe incidents. The report has a huge impact on the involved surrounding hospitals, on healthcare professionals, and on my medical team and on me. I was 1 out of 5 with life-changing injuries. A 6th patient died as a result of siloed, unstructured, and ambiguous data and information. Ladies and gentlemen, this is not what we want, do we? For the rest of my life, I have to cope with a severe, partially invisible disability, the Cauda syndrome, and with mixed feelings. So does my neurologist, the second victim, or should I say, more correctly, the other first victim. Because of the large number of healthcare professionals involved, they had to close the mixed case of these 6 patients. The inspector asked me to ask him to start a new investigation in my case. I didn't. Although I needed answers to the questions, how might we learn from what happened and how might we prevent it happening again? I wrote a few not published papers and a not published lecture, which I shared via my neurologist with the academia. This was my next step into healthcare innovation, after I had written the incident analysis from patient's perspective in my case years before. It was one of the first in its kind in the Netherlands. The insights I shared are used for research and for innovation in healthcare. Every day I take a lot of medication. My medication is provided by a local pharmacist. I know what I use, but neither my doctor nor my pharmacist has the overview Yes. I know what I use, but neither my doctor nor my pharmacist has the overview I have. I use an e-health application on my smartphone to list my used and prescribed medication and to help me remembering to take my medication. My GP uses a digital application for prescriptions. My doctors in the hospitals still print their prescriptions and send the prescriptions over an insecure connection called fax machine to my pharmacist because the hospitals aren't digitally connected to the pharmacies like the GPs are. Not yet. Why? I don't understand why. Oops. And health data exchange between hospitals. In a lot of hospitals, the fax machine is used for this, and professionals are typing the exchanged health data into the patient's EHR. X-rays or scans saved on disks are sent to another hospital by PostNL. Having me as a patient means that I put an end to using the fax machine for exchanging my data with other providers whenever I can. I gather the relevant information on paper or on disk and bring the data from the one to the other hospital by myself. I don't stay at home because I have some chronic medical conditions. I work, I travel, I have a social life. What if something happens to me in the Netherlands or abroad? I prepared myself for this scenario. In my handbag, I carry with me my emergency medication and a list with my most relevant health data and the names and phone numbers of my doctors on it. The list is in Dutch and in German. Via an emergency application on my smartwatch and smartphone, the first responder has access to the most relevant health data in the health app. Does this mean all's well that ends well? In the Netherlands, we have a private healthcare delivery system, and there's no national information structure. Somehow, this works very well. Healthcare is of a very high quality. But to make this high quality sustainable, we have to change something. Since 2011, the paradigm shifts from system thinking to putting the patient into the center. Because the patient is the everlasting constant factor in healthcare. It's about empowering the professional to deliver the best possible healthcare and about empowering the patient, leading the digital transformation in healthcare. My medical core team and I contribute to this huge innovation process. We share our experiences and acknowledgements with the academia and the government. The National Health Information Council at the Dutch Ministry of Health, Welfare and Sport is working on the Sustainable Health Information Exchange System. In this council, all stakeholders of the Dutch healthcare ecosystem are represented. 2016, the National Health Information Council formulated 4 outcome targets to be achieved between 2018 and 2021. Medication safety, patients' access to the data, standardized information exchange, and secondary use of data. As a member of the Chief Experience Officer Advisory Council to the National Health Information Council, I am concerned with patient safety issues in health information exchange. In the Netherlands, on a population of 17 million, now it's number to North Rhine-Westphalia.
18.
Yes. Every year, over 50,000 patients are referred to an emergency department after a medication incident. 50% are avoidable incidents due to incomplete or incorrect information. 70 patients a day. Some years ago, I was one of these patients. A few years went by till a medical doctor discovered why I was referred so frequently to the emergency department. Each morning, I pushed myself more and more to the edge of death. For hypertension treatment, I used a very common pill. This caused the severe angioedema. These are my healthcare providers. They have their own EHR system from different vendors. The EHR systems can't talk to each other. Please stop that vendor lock-in. The health data are unstructured in Dutch and written in free text. Each doctor uses his own medical language. For example, the chronic back problem I have has 5 different names. I have at least 8 different EHRs, each one with its own login procedure for online access. There's a fragment of my health data in every EHR. Another problem is that my EHRs can't communicate with my personal health environment. What I am doing until now is connecting all the data by hand. Sometimes I provide these data to my neurologist and GP because they don't receive automatically all the data about me from other hospitals. Still, I have more data about me than my healthcare professionals have. I use wearables and other digital tech to capture and manage my health data. What I want is uploading all this data to my personal health environment so I can share relevant data with my healthcare professionals in a safe, secure and trustworthy way. On top of that, I need especially the information in those data for managing my life. Patients' access to his health data is all about more equal cooperation between the patient and his healthcare professional. My neurologist thanked me this summer for pushing my GP and him not giving up, and for providing him all the information he needed in the diagnosing process for the pain and reduced strength in my hand and arm. After approximately 50 years, ladies and gentlemen, I finally know why my hand and arm are hurting. He made me also a lovely compliment by saying, "Ineke, you become a patient less and less. You sit more and more at my side of the table." I like that. Healthcare professionals, they too want the digital exchange of patients' health data and information to deliver good care. The exchange with other professionals involved in patients' care has to be safe, structured, and if possible, with patients' consent. Healthcare and IT professionals also developed health data applications for secondary use of data, for payment, research, governance, and quality transparency. This makes us, patients and healthcare professionals, happy. The National Medical Me program, MedMij, gathered all the standards needed for interoperability between health technologies and for the safety, security, affordability, and trustability of the used health technology. This short movie tells you more about the Dutch Medical Me program. It's in English. Takes 1 minute.
More and more people are interested in actively managing their health data, using the increasing numbers of health-related apps and websites. These developments are commendable, but at how many locations is our health data actually stored? Hospitals, municipalities, general practitioners, pharmacies, the gym, the list goes on and on. Having all this information in a single location makes it easier to manage, share, and use. This offers peace of mind, confidence, and greater insight, and lets you gain an overall picture of your health. MedMij makes sure that a personal health environment like an app and the systems at care organizations are able to communicate with each other safely and use the same language. MedMij sets the rules. The systems in healthcare environments and at care organizations must also meet the requirements set by MedMij, enabling partners affiliated with MedMij to share health-related information from different sources effectively, safely, and confidentially. MedMij gives you greater control of your health, as well as a more complete picture. You can learn more at medmy.nl.
Running out time? I'm 5 minutes, 6 minutes? 2 minutes? 2 minutes? 2 minutes. Then I have a call for action because I have still 2 minutes. My call for action here, I hope there are a lot of people with a lot of interest in the sector. So we like to cooperate with you. We can't make this on our own. On behalf of Erik Gerritsen, the Secretary General of the Dutch Ministry of Health, Welfare and Sport, of my medical team and of Icone, and of all the people we represent, we need safe, secure and trustworthy access to our data in your systems. So open your systems. We need transparency. We need the open APIs. It's not about the standard, it's about implementing standards. We ask you to implement the standards of the others. Let's work together to make the patient data exchange and the personal health environment to a success. And this is me. Thank you very much for your attention.
Thank you very much, Ineke. It was really a fascinating story, bringing together this patient life and technology coming in the end to help. Sorry to interrupt you in the end, but we also would like to hear the Hannu. So any comment or question immediately to Ineke right now? Okay, no, then make yourself comfortable. So then it's my pleasure to welcome our guest from Scandinavia, Dr. Hannu Hämäläinen from Helsinki, from Finland. And Hannu will cover, let's say, another complementary part of the story, which is also mentioned in the communication by the Commission, the secondary use of data. This is actually what is behind the big data thing, because without secondary use of data, there would be no big data. So Hannu will this explain much better. Let me just quickly introduce Hannu. Works today as a senior advisor with the Finnish Innovation Fund, Sitra. And it's just by chance, we were not aware, but just behind us you will meet a lot of Finns also, and Finnish innovation initiatives, but not Sitra, I think. And but Hannu has worked before in the National Center for Health and Welfare, which has a very crucial role in the Finnish healthcare system, and as well in the Ministry for Social Affairs and Health, which is also, let's say, has done a lot of legislation, planning and funding around building up those ecosystems. So Hannu, thank you that you came to us.
Thank you for the invitation, Medica and Stefan. It's nice to be here. Really honored to be speaking after 3 excellent presentations. And I was wondering if I have something to add, but I hope that I have something. So ladies and gentlemen, I'll take 3 points in my presentation. First, I'll ask why we have the data, why we have collected this kind of enormous amounts of data, and showing that what's the case of Finland. The second question is that why we haven't used that data which we have collected, and I try to show how we can build up examples of the secondary use of that data. And finally, I'm coming close to the Ineke's last question about my data, how we can manage this data, and what's the future of the ecosystems. So that's my 3 themes today. But before, I just shortly want to tell what is Sitra, Finnish Innovation Fund. It was actually 50 years ago. Finland is now 100 years old republic. About 50 years ago, Finnish Parliament decided to give a gift to Finnish population, and it was a stock of shares. And luckily, there were some Nokia shares included in that. And so today we have about 1 billion euros capital, which we are investing for the best of the Finnish population through different programs and teams. So we are in a way an independent foresight agency doing things before, taking risks and being innovative. We are working not just in the health and social affairs, we are working also in cycling economy, recycling economy. We just were voted in Davos as an example in the global scale of this kind of a development. We have been developing our management in the public sector, and so we are coming and going, not having all the time in the same areas. We change the teams, try to be a little bit forerunner. But Sitra has been involved quite a lot to this story which I'm telling, especially with its project to the secondary use of health data. But first, we have to speak for a while about the data. Finland is famous about thousands and tens of thousands or hundreds of thousands of lakes, a lot of forests. But we are also famous of that we have enormous and one of the best data lakes of the world. We have been collecting that data from 1970s with personal identification. Our population register history started on the 16th century. So we have a little bit background for this. But in digital format, we have a lot of data from health and population and about our society starting from 1970s. With personal identification, with possibility to use our unique identification which we get when we are born. We have built up a Kanta system which connects social and healthcare. So Finland is totally digitalized.